Hi, my name is Bill Cotel with Elite Patient Handling Systems, and today I'd like to discuss lateral transfer devices. We use these to move patients from beds to stretchers, both in the hospital setting and in the pre-hospital setting, and then move them from the stretcher onto the beds in the emergency room when you arrive. They're used in tandem to facilitate these lateral transfers. And why do you need them? Because as we know, when you move patients, you're always leaning over, you're grabbing sheets, and then you're trying to pull the patient over just using muscle, and you expose your lumbar spine, you can't engage your core muscles, and injuries occur. And utilizing these devices, we're going to minimize those injuries and hopefully extend your career as EMS professionals. So this is a maxi slide. Material is anti-friction. It's got some handles for assisting in sliding and not for lifting. They come in three sizes, 39, 29, 34, and 60. They're used they're used in pairs. So the first one the patient gets on, and we'll deploy that ourselves, and the second one is used as a runway onto the stretcher. And so the second one, when they're put together, you'll note that they move very, very easily, and it decreases the weight of the patient by about 75%. I'm going to show you quickly how to deploy this device with a patient, and Kate is nice enough to be a patient for us today. So let's take that off the sweatshirt. And just lay on the bed. So your partner can help by rolling the patient. You're trying to get her centrally located on the patient and tucking all the sides in. Roll it back over. I'll take her to me. Excellent. We pull our stretcher up. You want that stretcher to be just slightly lower than the bed. And then this part of the maxi slide will go under one shoulder for buttocks and both feet. And now it has a runway to the stretcher, and your partner is going to be producing most of the energy for the move. So it now becomes a push rather than a pull. So we'll put our hand on her shoulder and on her hip, and he's going to push her over, and I'm just going to guide. Ready? 1, 2, 3. And she slides over as easy as that. Very simple. Now she's a little bit low, right? This is where this comes in handy. I'm going to have Norm go to the very front. And he's going to grab, just grab this and pull up. So he's going to grab and just pull. And because it's still on this, she moves up nice and easy. There's a couple of ways now to get this maxi slide out from under the patient. This is going to come right out because it's already underneath. This one, you reach across, you grab it, and tuck it under itself. So now, this part of the maxi sheet is under the existing, the part that's underneath her. You just slightly pull, and it slides right out. Easy. Now you can put the straps on your patient, do patient care, and get her off to the hospital. Very simple to deploy. It takes just a little bit longer, but at the end of the day, your patient is safer, you and your partner are also safer.